So today we're demonstrating lift into the lips. And before we get started, this is a CO2 laser for a little problem I had. We're not talking about that today. If you want, though, you can call me and I'll tell you all the details. So today we're focusing on Nathaly, and Nathaly is here because she wants her lips to look. What do you want, Nathaly? Can I have a mirror, please?
Lumpy.
You want them a little bit fuller?
A lot.
Now, when you look at them, tell me where would you like them fuller, and do you want the top fuller, the bottom fuller?
Both. Because
Upper
I feel
and
like,
lower. So you want the
because
red
I feel
part
like I
fuller?
already have the outline. Maybe I just need them more full, but I don't want to do it like all. I want both more full.
No. Okay, we'll try not to do the Okay. So do we have the? Are you doing the dental block, or are you not doing the dental block? You're a brave woman. So what we're talking about is we can numb the gum line, and what that does is it makes it so it doesn't hurt when you do the injections. The only downside to doing the block is that it causes fullness in this area here and down here, and you're numb for an hour. So for those brave souls who don't want to do the dental block, I salute you. It's amazing. There are very few people in my practice that are able to do that, though. Now, we're doing the Lyft, which is a Restylane product. The Lyft is actually a form of hyaluronic acid that actually is a chunkier molecule. Oftentimes, if somebody is just looking for fine-tuning at the lips, for example, if we're trying to get the filter columns to pop out or the cupid's bow to be a little bit more distinctive, then we can use the Restylane. But if you're just looking for volume, the Lyft is really the best product. We can also use Juvederm. However, I like to caution people on using Juvederm in the lips because some people call it Moviderm. I love Juvederm, but it does tend to move just a little bit, which means that instead of staying within the border here of the lip, it can drift up just a little bit, creating an unnatural look. This doesn't happen all the time, but if you use a lot of it, over time it may have that effect. So this is why I love Restylane in the lip. It's not to disparage Juvederm because there are lots of applications for Juvederm. So Nathaly is blessed because she has beautiful lips. Since she's so young, the definition of the filter columns is great, and we've got really good cupid's bows here. We just want more volume. So what we're going to do is we're just going to inject into the body of the lip. How are we doing?
Good.
And now we're going to try to get the central part of the lower lip to be a little bit fuller than the sides. With this procedure, there are very few side effects. Usually just a little bit of bruising and swelling. Procedure done. To minimize bruising, swelling, what you want to do is stop anything for pain. 10 to 13 days prior to the procedure, except for Tylenol. Are you? It's official? Great. And that's all there is to it. Now, we recommend ice on the hour, every hour. 10 minutes on the hour until you go to sleep to minimize the swelling. They look gorgeous.